This is Tanya Petraszko from Canadian Blood Services. I'm one of the medical directors of the Cord Blood Bank, and it's my pleasure to present to you today a little overview on stem cells at Canadian Blood Services as part of your tour of the Edmonton facility. Sorry that I can't be there in person, and hopefully this technology will work. As you know, in your time at Edmonton Centre, you should be learning that Canadian Blood Services is more than just blood. We do collect blood and blood products for the country with the exception of Quebec, but we also provide diagnostic services for our transfusion recipients as well as for prenatal mothers and infants in the western part of the country. We also purchase in bulk plasma protein products for the country, excluding Quebec, and we're allowed to. That enables us to get good prices on these products, such as albumin and IVIG for our hospital customers and the patients. We run the One Match Stem Cell and Marrow Network, and we own the Canadian Blood Services Cord Blood Bank, which is the focus of my presentation today. And we also have an organ and tissue donation and transplantation registry, which is doing great work, but is beyond the scope of this presentation. So depending on what year of med school you're in, you may or may not know what a hematopoietic stem cell does. And by definition, a stem cell is something that's capable of both self-renewal and differentiation. So hematopoietic stem cells live in our bone marrow, in our long bones, and they can self-replicate and they can differentiate into red cells, white cells, and platelets as required to replace those cells as they die normally through the process of aging. These are different from embryonic stem cells, which are found only in embryo and differentiate into any cell of the body. So why are stem cells important? A stem cell transplant is curative for several diseases, including leukemia, aplastic anemia, some immune dysfunctions, congenital immune dysfunctions, and genetic disorders, both in children and in adults. Either because the cancer cells have replaced the bone marrow and have to be destroyed, or because the chemotherapy or medical therapy that's being used to treat the underlying condition destroys the bone marrow as a side effect. And so what we do is we replace the individual's bone marrow, their stem cells, and we reconstitute them with stem cells from a donor. And those stem cells then grow into red cells, white cells, platelets, and they also reconstitute the immune system. So where do donors come from? In general, most of these conditions benefit from allogeneic stem cell transplants, so from another individual, and the stem cells must be of the same tissue type as the recipient, which we'll get into. So the best match is a sibling. In the likelihood that you've inherited the exact same tissue type as your sibling did because you came from the same parents, that's the best case scenario, but only about 25% of patients have a match in the family, so we turn often to unrelated donors. And we need to look at donors in the same ethnic makeup as the patient, as the recipient, because they're more likely to have similar tissue types. How do we search donors and patients? Well, we use DNA markers on white blood cells, and these are proteins that we refer to as human leukocyte antigens, part of the HLA system. And we can find them very easily with technology these days. We just swab the inside of the cheek. We send that off in a kit that you can download, that you can request online, actually, at blood.ca. And the Canadian Blood Services testing lab will test for HLA antigens, and there are 6, HLA-A, HLA-B, and HLA-DRB1. There are many more than that, but these are the common ones. And you have 3 from each parent, so in fact there are 6 of them. And the important thing about the HLA system is it's the part of our immune system that distinguishes self from non-self. So this is important because bacteria have different HLA markers on them, essentially, and our body knows to attack them and destroy them. But our immune system does not attack and destroy our own kidney, for example, where the HLA markers are the same. And a match level is significant. It's a significant determinant of graft rejection or graft versus host disease. So if you transplant a recipient with someone else's bone marrow and you want that bone marrow to take and not be rejected, it needs to be a match to the recipient. Similarly, if they're not matched well, the new immune system that starts to grow in the patient, in the transplanted recipient, will then attack the patient. And we get something called graft versus host disease, which can be fatal, affecting internal organs, skin, and other parts of the body. So it's a balance between graft acceptance and GVHD. How do we collect stem cells? There are 3 ways to do it. The screenshot here on the left with the needle is the classic way to do it and the original way to do it which is in the operating room under a general anesthetic with the patient lying on their stomach, prone, and the physician aspirates about 1 liter of bone marrow directly from the patient's hip, requiring a couple days of convalescence on the part of the donor. The cartoon in the middle shows another way to do it, peripheral blood stem cell collection. We give patients, donors, a medication called GCSF, which stimulates production of the stem cells within the bone marrow. So they fill up the bone marrow and they spill out into the peripheral blood, and then we can collect them using apheresis machine. The machine draws the blood from the donor. It's centrifuged in the machine. The stem cells are collected up, and the blood and other plasma and other parts of the blood components are returned to the donor, and that process takes about 5 or 6 hours. Lastly, on the top left corner is the placenta with the umbilical cord hanging below, and the placenta in cord is rich in stem cells. And this is because in the fetus, stem cells circulate, and then the moment the cord is clamped, within the baby, the stem cells migrate into the bone marrow where they live, and they no longer circulate in the blood, but they remain there in the placenta. And this is a great source of stem cells because it's normally discarded as biohazardous waste, and there's no risk to the donor, mother, or infant in harvesting those cells. So let's talk about the One Match Stem Cell Donor Program at Canadian Blood Services. It's a program that's been around since 1988, and what we do is we recruit and find healthy, committed volunteer stem cell donors. We maintain a national registry of these donors. We're the 10th largest in the world, and we link with international registries of stem cell donors. So on behalf of patients and their physicians, we conduct searches to find HLA-matched donors, adult donors, or cord blood stem cells in inventory in the world. And then once a donor or cord blood unit is identified, Canadian Blood Services coordinates the collection and the delivery of these stem cells to the recipient. So they might be harvesting a donor in Germany, an adult donor in Germany, and CBS will facilitate that collection and ensure transport to the recipient who might be in Toronto. One Match is linked with 75 registries in 53 countries, and currently there are over 28 million donors in the global database, which is fantastic. However, all stem cell sources are not the same, and the racial and ethnic group of the patient influences the likelihood of having a matched graft, as I mentioned before, and I'm just going to show you a little bit about this. So currently in the Canadian One Match Marrow Network, we have almost 400,000 registrants. 70% of them, as shown here, are Caucasian, so only 30% are not Caucasian. Now, the Canadian population is more than 70% not Caucasian. So there are quite a few non-Caucasian patients who cannot find a match because their ethnic group is underrepresented among adult registrants. Transplant centers also like to transplant donations from donors who are male and young for a lot of different reasons. And of the registrants on the Canadian Stem Cell Network that are young ethnic males, there's only 8%. So there's a big gap in the donors we have registered and the recipients who need the stem cells. Furthermore, we have to phone these donors. Maybe they've moved. We have to find them. Maybe they registered 3 or 4 or 10 or 15 years ago. Now they've developed health complications that render them unable to donate. So these are not immediately available stem cells. Cord blood helps us close this gap. First of all, they're immediately available because they're already in the bank, and we'll talk about that in a moment. But this is a model done in the New England Journal of Medicine a few years ago, looking at the U.S. National Marrow Donor Program, which looked at the HLA types of over 10 million donates and cord blood units in inventory, and finding essentially a perfect match, an 8 out of 8 HLA match. If you're Caucasian European, it's a 75% chance you'll find a perfect match, which still isn't perfect. But if you go down through this list, you'll see that it decreases to the point that Black Americans or African Americans of all, Black Americans of all backgrounds, whether African or West Indian, only have up to 20% chance of finding a perfect match, which is abysmal. And that's partly because there's underrepresentation of Black Americans on international registries, but also because within the Black American HLA types, there's a lot of disparity. There's a lot of diversity in the HLA types of Black Americans. So even if you had 10 million Black Americans on the registry, the match rate would not be 75%. So when you look at cord blood stem cells, these cells are immature, so the immune tolerance is different, and there's a lower likelihood of of graft versus host disease. There's a lower likelihood of graft versus host disease when you are a recipient of a cord blood transplant. So we only need to match for 6 HLA alleles, 6 out of 6 match. And the numbers for Europeans and Africans are still disparate, and they're not great, and that's likely because these are adults, and adults aren't commonly transplanted with cord blood units because they're small. But if you go down to the likelihood of having a 4 out of 6 match, which is not only tolerable in adult donors or all donors, but it is actually successful because of the immunologic immaturity of cord blood stem cells. 80% of all adult populations will find a match, certainly all of them if you're Caucasian, and all children in all ethnic groups. So you go from a 19% chance of finding a match for an adult registrant for a recipient versus 80% in an adult using cord blood stem cell. So the likelihood, here it is again, the likelihood for non-Caucasian finding a match is up to 30% from an adult donor and 80% from a cord blood unit, which is why Canadian Blood Services moved to establish a cord blood bank. And other reasons that cord blood is important is, as I've said, the lenient HLA matching increases the likelihood that a recipient will find a donor. As I've said, there's no risk to the mother or the baby in donating. It's collected in advance, tested, frozen, and ready to use. If you need that, it'll be ready. You can get it within a day, essentially. There's a lower incidence of GVHD. That's why we have better HLA matching. The units are small, so there's definitely enough cells in a unit for a child, but an adult might need 2 units, which is one of the drawbacks of cord blood. And they're about $40,000 if you purchase them internationally, which was one of the reasons that Canadian Blood Services was tasked by the governments to do this in-house so that we wouldn't have to pay this fee. So beginning in September 2013 in Ottawa and then completing in January of 2015 in Vancouver, we established the Canadian Blood Services Cord Blood Bank, which is a national public inventory, excluding Quebec. It has high quality, ethically diverse stem cells, and the mandate is to increase transplant opportunities in Canada and worldwide. We have 4 hospital collection partners. The lowest hole is the hospital in Edmonton, and then there's the Women's Hospital in Vancouver, the William Osler in Brampton, and then the Ottawa Hospital has 2 campuses, the Civic and the General. So what do we have? We made a decision when we opened this bank years ago that we wanted to have good quality cells. The majority of cord blood units frozen in the world have a relatively low total nucleated cell count, which is a predictor of engraftment. Many of them have 0.9 to 1.2 times 10 to the 9, and these are not being used. So we did not want to fill our bank with small cords that no one would want to use or purchase as a revenue generating thing for our bank, and that would not be helpful to Canadian recipients. So we set a high target for Caucasian cords, 1.5 times 10 to the 9, and a slightly lower one of 1.3 times 10 to the 9 to make sure that we could capture as many diverse HLA types as we could. These are high quality cords. We have excellent post-production results and viability data. The attached segments on the bag are there. Many banks in the world don't have these, so it allows for further testing, and we have low microbial contamination rates. But very good bank. How are we doing? As of July 2017, we have collected over 16,500 cord blood units from Canadian moms. We have over 2,600 in the bank, and over 2,100 are listed and available for transplant through one match, with the remaining 500 still in process. We have distributed 6 for transplant, and our goal is to have 60% non-Caucasian, and we're almost there at 58% non-Caucasian. So very different from the 30% non-Caucasian we see on the adult registry. We're very pleased, and I don't have the data to show you, but the ethnic diversity in Edmonton is different than the ethnic diversity in Vancouver, which is different again from Ottawa and Brampton. So the 4 collection sites are very different in the patient populations that they serve, and we're getting a lovely representation of Canadian ethnic diversity, including Black Canadians, Arab Canadians, and First Nations Canadians, although the hardest group for us to represent is the First Nations group. I also want to point out that 6 units already distributed for transplant with an inventory of 2,100 is also excellent, and I think it speaks to the high quality units that we have in the bank. Who can donate? We would like healthy pregnant women. They must be 18 years, and they have to be free of any disease that could be passed on to the recipient. So obviously can't have hepatitis or HIV or any other viral illness. They can't have a malignancy, and certain chronic diseases would render them ineligible. They have to be a term baby, 34 weeks, a single baby, not multiple birth. And unfortunately, they have to be at one of our 4 collection hospitals, which is the biggest weakness of our program, that we can't possibly be everywhere. So if a woman wants to deliver or is delivering it at one of our hospitals and wants to donate her cord blood, we have been working with the community physicians, midwives, and other healthcare practitioners to make sure that the moms have the discussion with their caregivers early in the antenatal period so that they know what they're doing before they deliver, and they come already with a permission to collect form signed. There is no advance registration, which is done by some other blood banks, or cord blood banks, but they have the permission to consent to collect form already. And basically that says you have permission to take my placenta, extract the cord blood cells, and do some testing to see if there's enough. And if there are enough nucleated cells there, I understand that you're going to come back to me. And at that point, we do a second full informed consent of the mom after the baby's born, and we do a full maternal screening questionnaire and testing. So again, it's very important to us that the moms know before they come in about the program. This is what the maternal information booklet looks like. That would be in the caregiver's health office, or that can be downloaded online from our website, blood.ca. And we're really excited that you've taken 15 minutes to listen to us promote this project and this program, because you're the incoming physicians, and we need you to tell your patients, we need you to be aware and to recruit for Lois Hospital, and we need you to tell your friends. And if you or your loved one is going to have a baby soon, please consider donating your baby's cord to the bank as well. Thank you very much, and enjoy your time at Canadian Blood Services.